Kent has 2 cases, and Michigan has 552 cases, with 180 cases being in Detroit. We have 1 confirmed case of COVID-19 in Windsor-Essex County. Overall, 314 individuals have been tested for COVID-19, and 200 tests are pending as of the end of day Friday. These numbers reflect the total amount of testing done in our community, including the new assessment center at Windsor Regional Hospital Alette campus. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, regarding our first case of COVID-19.
Good morning, everyone, and thank you for coming. The Windsor-Essex County Health Unit would like to confirm the first positive case of COVID-19 in Windsor and Essex region. The case is a male in his 60s who returned to Windsor after traveling on a Caribbean cruise and arrived back in Windsor on March 10th. He has been in self-isolation since he returned. He developed symptoms on March 11th and was tested at the Windsor Regional Hospital Assessment and Testing Center on March 16th. He was a close contact of a family member who was also tested positive for COVID-19 outside of Windsor and Essex County. He's currently recovering at home with mild symptoms. He did all the things right in terms of following the directions of public health, staying home and not going outside, and follow the self-isolation protocol. We'd like to continue to stress that this is one of the cases that we were hoping that will show up in Windsor and Essex, and we were on top of it. We made sure that the person got the information that he needed to ensure that they are following the self-isolation protocol. As we are preparing for the return of March break travelers, we like to strongly urge all residents to practice social distancing, avoid crowds, and close contact with those including immediate family members, as well as staying home as much as possible. Especially if you are unwell, if you have any symptoms, if you are sick, please stay home and contact your healthcare provider or the health unit. This new case also underpins the robust measures that we have been taking to restrict travel, particularly outside of Canada. So anyone who is traveling outside of Canada for non-essential reason, they should not travel outside because this is a travel-related case. We will continue to investigate and monitor all individuals who are at a risk of exposure. We continue to encourage residents to take appropriate preventive measures to ensure that they stay healthy, including regular hand washing with soap and water, coughing or sneezing into tissue, and hand washing. Disinfect, and most importantly, staying home when you're sick. All returning travelers are reminded to self-isolate for 14 days. Do not go to work. Do not go outside to public places, and monitor for your symptoms. Individuals who are suspected can go through the self-assessment tool that's online as well. In addition, I would like to add what is happening locally as well. So last night, I have issued a strong recommendation that the following non-essential facilities should close immediately. These recommendations were followed by an official order on Monday, March 23rd. It includes retail stores, including those that sell clothing and apparels, books, home decor. It also includes personal services settings, including hair salons, day spas, tattoo parlors, and nail salons. We like to put these strong measures in place to further reinforce social distancing and limit the spread of COVID-19 in our community. We must act together and close these non-essential services and business until at least April 5th. I would like to go through some of the information with regard to self-isolation because I think it is important for people who are self-isolating to know what exactly that they're expected to do, and also for the community what self-isolation means. So self-isolation means the first and most important thing is stay home. They're not supposed to use public transport. They're not supposed to use taxis or ride shares. They're not supposed to go to work, school, or other public places. Your healthcare provider or public health unit will tell you when it is safe to leave. We make that contact. We'll let the individual know. The second point is limit the number of visitors in your home. Only have visitors who you must see and keep the visits short. Keep away from seniors and people with chronic medical conditions, for example, diabetes, lung problems, immune deficiencies. Avoid contact with others, even in your home. Stay in a separate room, away from other people in your home as much as possible, and use a separate bathroom if you have one. Make sure that the shared space have good airflow, that is open windows. you still need to keep distance. If you are in a room with other people, keep a distance of at least 2 meters and wear a mask that covers your nose and mouth. If you cannot wear a mask, people should wear a mask when they're in the same people should wear a mask when they're in the same room as with you. If you're coughing and sneezing, cover your cough and sneezes. Make sure you're washing your hands with soap and water thoroughly for 15 to 20 seconds, or you can use an alcohol-based hand sanitizer if soap and water are not available. Make a mask over your nose and mouth if you have to leave your house to see a healthcare provider or even walk for a little bit. But I urge you, do not leave your house if you're under self-isolation to ensure the safety and well-being of yourself, your family members, and also for the community. All these guidelines are on our website. People can go. We have 3 different type of information, a fact sheet coming from Public Health Ontario. One on how to self-isolate. The other one is how to self-monitor. And then the third one is self-isolation guide for caregivers, household members, and close contacts. I request all of you to go and read those documents if you are interested in understanding what does it mean. Individuals who are told to self-isolate, they are given all these instructions very clearly, and I'm hoping that with explaining some of these points would help some of our residents understand what it means for self-isolation. At this point, I can take a few questions from you.
The gentleman, it's not community spread at this point, you confirm it definitely came from outside the province?
That is correct, because this person meets the exact criteria. He went to a Caribbean cruise outside of Canada, returned, was symptomatic with fever and cough. Those are all the symptoms that we ask people to monitor. He was tested at the Testing and Assessment Center and then later came back positive. All this time, the person was closely monitoring the symptoms and was self-isolating and following the instructions of public health.
So an example of doing the right thing, like you had said.
Exactly.
Since when do you know he's infected?
So we got the positive test last night and we reported it back to the community immediately.
How is he being handled in the hospital? Like, how are the staff there instructed to sort of deal with a situation like that?
So this person is in his own home and he's recovering fine. So there is no issue from the hospital perspective other than the part that he went there for testing.
So his wife has the COVID-19 positive?
I didn't say that. It's close family member outside of Windsor-Essex was a positive case. So he knew and he was monitoring his symptoms and following the guidelines of public health.
What does close contact mean?
Okay.
More detail on that?
Okay, so what close contact means is any person who is living in a household and we spend a significant amount of time together, more than an hour at a distance without having any personal protection. And so all of those individuals who are in contact with that person, we try to reach out to them as part of our contact investigation. We connect with them, we notify them what do they need to do in terms of monitoring their symptoms. We then classify those individuals into high risk, medium risk, or low risk, depending on their contact time, and then given appropriate instructions. All high risk individuals, if they spend a significant amount of time together with the case, we ask them to self-isolate even at that time. For those who are considered as low risk, they are asked to monitor their symptom. Low risk means even just having some contact in a very brief moment of time without having that personal contact.
Was he considered high risk then?
He was considered high risk because he had a close family member who was tested positive.
Okay. 318 is the total for Ontario. Is this number included in that?
I believe so.
This was from yesterday. So the numbers I have are from yesterday, so it should include that.
In terms of this case, is there any contact tracing that's done? You know, how confident are you guys that there wouldn't have been any community spread from this individual, that he was able to self-isolate in time to limit any spread of COVID?
So we feel confident in our processes, public health management. We do that all the time. So when this person went to the Testing and Assessment Center and was notified that he was tested, anyone who in Windsor-Essex is tested, our staff get in touch with them. We provide them with all the education. Healthcare providers who are testing them, they also provide them with the education. We further reinforce some of those messaging with respect to what they need to do to protect themselves, even if they have more family members in the house, and give explicit instruction that what they need to do. And depending on who they come in contact with, as I said, if it's a close household contact, they're also provided instructions. If they need to be in isolation, we provide them with the information that, yes, you need to be in isolation until we get a positive results back, or until the 14 days period has passed. All those detailed instructions are given to them. And I think I'd like to reassure that this person, because he followed all the right instructions, we still feel that the risk to our community is low because he meet all those criteria, and it could have been different if there's anything different. So I think it's further reassuring that our system is working, and we are following all those guidelines and protocols to ensure the safety and well-being of our community.
In terms of Monday, you said you're recommending now for retail shops and the like to close. What does that look like on Monday when you're saying it becomes in order? Are there bylaw enforcement, police, like how is this enforced? How do you guys look after this?
So under this Health Promotion and Protection Act, Section 22, which allows the medical officer of health to issue an order in the threat of a communicable disease, which we feel that it is there. So we would be using that specific order to request businesses to shut down. And obviously, we are expecting that majority of them would voluntarily comply, and we don't have to get to the point of enforcing it. But if it gets to there, our health inspectors will be enforcing that. Excuse me. And we will be working with the municipality as well to do some further enforcement, because there are other provincial directives around the closures as well.
So from what you've seen so far in Windsor-Essex, in terms of how people have adhered to the rules, how they've handled this whole situation, what's your assessment of how people are adapting?
So I think it is a change. It is a different environment. It is a different time. People are adapting to some of those recommendations. There are always some who don't follow the instructions, but we're hoping that when all of these things are happening, people take that as their social responsibility. As I continue to mention every day, we all have a role to play. I have to fulfill my responsibility. Each one of you have to fulfill your responsibility. The organization, the employers, they have their own responsibility as well to make sure that they're not letting the returning traveler back to work, especially if they're coming in from outside of Canada. So all those things reinforces the need for a community cohesion. We need that, especially in this time, to act together. And I think that's what I'm trying to urge, that we all have a role to play, and we should be following the guidelines and the recommendations to keep our community safe.
It sounds like this is a crucial point as well, where once you get that first case, it's very easy to slip into 2, then 4, then 8, and so on. How are we on that front? How worried is the health unit, or confident is the health unit that we can avoid that exponential uptick?
So we are learning every day from other countries and also from other jurisdictions. You rightly said that, we never said that we won't get a case. It's just a matter of time that when we will get a case. We will get more cases as well. So I think the important piece is, what can we do to reduce the impact of those cases, and also try to reduce the peak of those cases? Like, let's say if we don't take any measures, how many cases we will get? And if we are taking these measures, how many cases we can prevent? I think that's where the focus is, that the majority of the cases we can prevent, that's a good thing for the community. And I think that's what the aim is. All these measures that we are putting in place, we are quite confident that it would reduce the amount of physical contact with the majority of the population, with the school closures, with the facilities closures, with the bars and restaurant closure. It will limit that physical contact with the community, and by the analogy of how these infections spread, we should see a decline in the number of cases in our community.
Any indication just yet the effectiveness of the closures we've been experiencing over the last week?
Our inspectors are continuing to connect with the places and businesses. We are getting complaints as well, and we are following up on it. Majority of the businesses are in compliance, so there's not an issue. And as I said, people are taking it seriously. Even businesses and owners are taking it seriously, and we would just continue to reemphasize that.
But do we
Well, I think that's where the scientific pieces comes in. We are learning from other jurisdictions as well. We are learning from other countries what they are doing and what impact it had. If you look at the example from what happened in China and in terms of the measures that they took, the impact on that. And then we are looking at South Korea, what they did and what impact it had in their community. And then even at a smaller level, that what are those impact in the community? Every community is different. We have a different type of healthcare system. We have a different population density. We have a different public health system, and we have different rules and regulations when it comes to public health authorities and what they do and what they can't do. There are some good things about public health in the local region. It allows that flexibility for us to make decision that is best for our community. We don't have to go to wait for the province to make some of those decisions. If this decision is important for our community, the medical officers of health are empowered to make those decisions. And I think those are the decisions that we are making at our individual level, looking at our community. And all of those systems are in place to make sure that the community is protected. We are blessed to have this close collaboration with all our community partners and trying to work together to find a solution. So we're all in this together, and we'll continue to work together with all of our partners.
What's the next step at this point? You've closed a lot of social places, non-essential services. Is there some other stuff that can happen after this at this point? What's the next move in terms of?
So we are continuously monitoring the situation, as I said, and continually assessing the threat, what the threat is to our community. So some of the consideration that we are making is based on what is happening in the surrounding region and how it will impact our community. Michigan example would be a good one because Michigan, we are in close proximity to that. Their case count is growing rapidly. We are monitoring that. So even though when we didn't have a case, we felt that it is important that unless we protect our community from all those impacts, it will have an impact on us. So we took this measures proactively. Yesterday and the day before, I also urged the people who are seniors or who have a immunocompromised system, they shouldn't go outside of Windsor and Essex or even outside of their home if they don't have to. So taking some of those measures are important for us to ensure the safety and well-being of our community.
What will be the next steps in terms of closures and rules, though?
We will be assessing the risk depending on what is next, but it could mean all the way to essentially closure of pretty much everything other than the essential services. But we, as I said, it would be assessed looking at what is happening at the community, but we are pretty much going in that direction. Seems like that's the direction that we are heading, and we'll make that decision when it needs to.
How many tests are out right now? And in terms of, could we have a rush of possible positive tests? Because I took, what, the 16th was one gentleman, so it takes a few days. Is it possible we might have some more coming soon?
The Public Health Ontario lab is backlogged, but I can assure the community that everyone who is tested, who meets those criteria, we have provided them with a specific instruction that irrespective of their test results, they are still following the recommendation as they are a positive case. So they are told to self-isolate. If they need any healthcare needs or they need to see a doctor, they need to go to the hospitals, all those arrangements, and how to do that, they've been explained. And we will continue to have that connection with them. Our staff are connecting with them to monitor their symptoms and ensure that they are following the guidelines that we are providing them. But as I said again, I think I want to request all those people who are in self-isolation to follow those guidelines and stay home unless they have something, some kind of a medical emergency or medical needs that they need to. And please contact Public Health if you have any questions with respect to your ability to do something versus the other.
Now that there is a positive case in the community, is it possible for the testing criteria to change? I know that before it was necessary for someone to have recently traveled. Is that possible?
Well, the province is actively looking for it. The clinicians who are working in those assessment and testing centers and even the healthcare providers, they do have that flexibility. They can make that assessment if someone is really sick or if they have a suspicion that they have the ability to make that decision. They don't necessarily have to stick to this criteria, but it has to be a clinical judgment. It doesn't mean that just me, if I want to get tested, I should be tested. I think we should be responsible, recognizing that the issue is impacting not only just our community, but across Windsor and Essex.
In Germany, they are testing a large part of the communities, and it seems to be a very good strategy. Is it something that can be done here?
Good question. Germany and South Korea, they're both having doing mass testing, which is definitely something that gives us better understanding of how widespread it is, especially when we're talking about any risk of community transmission. That's a good indicator for us to have a better handle when we have more data. But we are hoping that with the expansion of these testings, and then right now all the tests are going to public health lab, and it will be shipped out to other regions, such as in London. So when we have more test sites available, our ability to test individuals would increase, and we're hoping that we'll have a better handle on that. But definitely testing more would give us a better sense of what is happening in the community.
There's 200 tests out right now. When do we see the results of those? And how quickly are they coming back if they are backlogged, like you say?
So the tests are taking about 4 to 7 days to return.
Are there efforts being made to speed that up? Are they adding resources in the lab?
They are looking at adding more labs locally. So we hope to have another lab in London next week.
When you say they, is that Berlin, is that the province?
No, it'd be the province.
Okay. All right. Thank you very much.